Hey everybody, this is David, host of Highway to Health podcast series. Thanks for being with us. If you've tuned in before, you know that we're passionate about discussing this open road journey that we're all on to improve access to healthcare, the experience that our patients and providers have during the healthcare journey, and then making sure that the outcomes are always improving. And one of the biggest threats or challenges to that journey is health equity. We will refer to it today as health literacy. And that's why I'm so excited to have the CEO of Ostro on the show with us today, Chase Feiger. Chase, welcome to Highway to Health.
Thank you, David. Great to be here.
Man, I'm glad you're here, and thanks for making the journey up to Dallas.
I appreciate it, man. Always great to be in my hometown. You guys have a really beautiful setup here.
Well, thanks.
Yeah,
we're glad you're here, and you're welcome back anytime. Before we get started, this has been a tradition of mine. I love hearing about the healthy habits the busy folks in this industry have built into their daily routine to make sure that they're physically, mentally strong and fit so you can be there for the communities that need you the most. So share with us and our listeners, what are some of the daily habits you've built in to maintain that health?
Absolutely, David. First and foremost, I want to start off by saying that it's crazy to me when I meet so many executives, whether you're CEO, COO, CFO, and I find out that you're living a very sedentary lifestyle. There's only so much direct attention. There were a number of research studies done on what's called direct attention and indirect attention. And what direct attention means is anytime you're reading a book, anytime you're at the office, writing an email, putting together a PowerPoint deck, an Excel spreadsheet, sitting down and having a conversation with someone on a show like this, that requires direct attention. A lot of people think by taking a break, I'm going to go watch TV, I'm going to read a book. But they don't recognize that watching TV, reading a book, that's also using up that same direct attention. So think of direct attention as a fuel tank. Every time you use it, whether you're watching TV and you're taking that break,
right,
or you're reading a book or writing an email, the only way to recharge direct attention is indirect attention. And indirect attention comes in the form of going for a walk, going for a run, going to the gym, lifting weights, Pilates, tennis, basketball, any physical activity. So, I take the approach of I'm going to practice what I preach. And what that means to me is, I'm working out 6 to 7 days a week. I'm not lifting weights every single day. I'm lifting weights around 4 to 5 days a week, and I'm putting in, on average, if you look at my phone right now, and we could pull it out later in the episode for proof and evidence, average number of steps a day in June was over 18,000 a day.
Wow.
July over 18,000 a day, as well as May over 18,000 a day. So I try to keep that active lifestyle when I'm not lifting weights. It also means diet. Diet, nutrition, as we know, is 90% of the journey.
Sure.
So I do intermittent fasting.
Okay.
I will run 16 to 18 periods of full intermittent fasts. And when I'm eating, I'm consuming highly nutritious foods, not empty calories. So that's my approach.
It takes a little bit of everything.
It takes a little bit of everything.
And what I've learned the most from executives like yourself when they share these stories is it doesn't have to be that complicated. Yeah. You know what I mean? Sometimes it's just getting more steps in.
Yeah.
Sometimes it's just eating the right foods. But I haven't talked to an executive yet where they've had this complex, unattainable system or habit. And I think we can all learn from that. You can start small, find what works for you, and then build on it.
Yeah.
But I appreciate you sharing that, because
of course,
that's not always an easy question to answer. Let's kind of set the stage for our listeners here. If you go to a show, if you tune into any podcast, if you are at a convention of any kind in healthcare these days, the topic that everybody starts with is health equity. Mm-hmm. And that's a broad umbrella. I like the way you put it. I like the way you describe it. And you use the term health literacy. Mm-hmm. Share with us what that means to you.
Before we get too in the depths of what health literacy means, I want to start with a parent term of really where health literacy comes from. So first and foremost, we've seen the consumerization of so many different industries.
Yeah.
We've seen the consumerization of transportation, the move from taxi medallions to being able to go on your mobile device, your iPhone, your Android, order an Uber, order a Lyft, order a Didi. If you want food delivery, Postmates, Seamless, DoorDash. So the consumerization of food delivery. We've seen the consumerization of video rental. Don't get me wrong, I miss the days of Blockbuster, walking in there, getting my candy and my video. But it's a lot more convenient being able to sit there, click a button, and watch HBO Max,
Right.
Netflix, Hulu. And we've even started to see the consumerization of healthcare. Companies like Hims and Hers, Roe, Nurx, that are providing virtual telehealth platforms that are vertically integrated with mail order pharmacy options.
Right.
Where if you suffer from conditions like erectile dysfunction, you require you're needing to be on, or you're wanting to be on birth control, any number of lifestyle conditions, you have that option available to you to see a provider right then and there, conveniently, and being able to then have your prescription sent to you in the mail at home through cash pay. So take a big step back from that. When you actually look at a vast majority of healthcare, if we were to bring on a patient right now,
Right.
Pull them right out of UT Southwestern or Parkland Hospital and have them sit on the show with us and say, how consumerized was your experience from the moment that you recognized that you needed to go to the hospital, all the way post-discharge, all the way to the follow-ups that you're doing in outpatient health clinics? My guess is that they would say on a scale of 1 to 10, how consumerized was it? How frictionless was it? How easy was it? How convenient was it? They'd probably say 1 or 2 out of 10.
Right.
Now, there are certain things that overall companies have been investing in to try to improve that experience. As we've seen the shift from fee-for-service to value-based care,
Right.
There's so many different concepts at play there. But I'll ask you this, David. Do you think healthcare has been truly consumerized yet?
I think the biggest challenge with this is we have patients are starting to expect from healthcare what they are experiencing in other industries.
Mm-hmm.
And so that helps the progress. With that said, I still think we have this low expectation of, well, this is the way it's always been.
Mm-hmm.
And so we settle. Whether it's from the provider side, we settle for a lower experience for our patients, or even from the patient, it's like, it's a necessary evil.
Yeah.
But what I love about these conversations is it doesn't have to be that way. And so to answer your question, no, if I was rating my experience from my provider, my healthcare journey compared to Amazon or Chick-fil-A,
Yeah.
it would be a drastically lower rating.
Yeah.
Because if I could expect that from my provider, we're not anywhere close to that. And so, you have to look at it. There's shades of gray there. To me, all that means is there's a lot of opportunity, a lot of potential.
Absolutely. And to your point just now, right? It may not be like Chick-fil-A or Amazon today, but it can be, and it should be. Ultimately, it should be harder for me to order, chicken McNuggets and French fries than it should be for me to access the information I'm looking for to learn about new oncology or cancer treatments. It should be easier for me to, instead of sitting at home, watching a movie, it should be easier for me to be able to understand my diagnosis,
Right.
to be able to understand the condition that a family member is undergoing, so I know the role that I can play in their personal healthcare journey, but it's not. And so we're still in the very early innings of the consumerization of healthcare. And I'm very excited by the push and the momentum that the health system more broadly is recognizing the effort that it needs to put in to vastly improve that experience. But again, let's boil down consumerization for a second. Consumerization means when you interact with that digital experience, that app, again, name the one of your choosing, it should feel as easy as if you're text messaging or you're using Instagram or Snapchat. It should feel as easy as Uber and Lyft and all these other apps. And what that means is it should be convenient, it should be frictionless, and it should have content that you actually understand. And so health literacy fits within that third category, content that you should understand.
Yep.
Ultimately, you need to be able to provide the content, putting complex terminologies for a rare disease or an oncology therapeutic or a cardiovascular disease drug or a drug for kidney disease. It only adds friction for the patient, and it only adds more complexity. By the way, friction can't be created or destroyed. If a patient is experiencing friction and they don't understand exactly how that therapeutic works, guess what? That friction gets passed on to the doctor,
Right.
who's already constrained. So again, what does health literacy mean? Health literacy means being able to have an experience that's seamless, that's easy, that's naturally intuitive, that has content, most importantly, that you can read the first time and you just understand. You comprehend it. Whether you're a third grader or a fifth grader, regardless of your demographic profile, socioeconomic background, educational experience, it should all be easy and well understood. That's what it means.
Yeah, for a lot of reasons, right? I mean, this goes into, empowering the patient to better manage their care and own that responsibility. But you're asking way too much of the patient community, the patient population at this point, because it's unfair to ask them or expect them to understand, the different therapeutics that are out there, the benefits or the risks associated, because we're not doing a great job communicating those things to them.
Right.
And then you touched on something, and this is where I want to go next. When that friction is there and that gap in understanding for the patient community is there, that all translates and falls back onto the provider community.
Yep.
And more stress, more burden is placed on them. And we all know there's not enough of them.
Yeah.
And they're spread so thin already. So talk to me a little bit about how health literacy impacts the provider community.
Absolutely. As I mentioned before, friction can't be created or destroyed in the context of this example I'm giving. The idea is, as you just mentioned, that friction that the patient experiences gets passed on to the provider.
Yeah.
We're going to have a shortage of over 200,000 providers by 2035. We're seeing more and more providers post-COVID that are actually retiring because of burnout, because they're taking on so much additional burdens, because of how the whole healthcare ecosystem is changing, all the administrative tasks that they're involved in, putting all the information they need to every single day in the electronic health record system, having to fight uphill battles when you need to get a critically important drug for your patient approved through a prior authorization. I mean, there is friction every single step of the way. So if we have any opportunity to remove just a little bit of that friction on behalf of the provider, we're doing them a service. So again, if I actually, let's assume that, let's start off with the way that this could work. You look at the way pharmaceutical advertisements work today. One of the big benefits of life science advertising is the fact that it's not just about educating the patient or the doctor on a new drug, but it's educating the doctor and the patient on a new potential disease condition that they've not yet ever heard of. So let's assume, for example, I'm a patient who, and this happens a lot actually, where patient starts to experience a first symptom. Let's choose a disease, let's choose a disease like, multiple sclerosis. Okay. So patient is starting to have tingling in their toes. They're starting to have urinary incontinence. They're starting to have blurry vision. On average, it takes 2.5 years to diagnose a multiple sclerosis patient. It takes 4 to 4.5 years to diagnose a patient with type 1 diabetes. If pharma is doing a big service right now in that they are educating patients, educating patients, potential diabetic patients, potential MS patients on those particular symptoms and that specific disease condition. So wait a second, I just heard an ad. Wait, I have numbness in my toes and blurry vision. Maybe I should go talk to a doctor. Maybe I should go see a doctor to see, do I have this potential disease condition? Awareness, shortening the time frame between awareness. Wait, I could have X. I could have Y. Awareness to action. So right now, in that moment of awareness to action, there's friction, right? I.e., what is the friction? I see the ad. Maybe I should go talk to a doctor. I could have MS. But wait, I've got to go pick up my child from school right now, right? It's almost 4 o'clock.
Right.
Oh, wait, I need to cook dinner tonight. I need to get dinner done. Oh, wait, I need to get up early tomorrow and get to work, get to the office early so I can get a quick workout in. I.e., the friction is all of those life events that are getting in the way. Mm-hmm. Patients, i.e., I like to, every patient is a consumer, right?
We're all patients.
We're all patients, right? And we're all consumers. And the idea is, how can you make that experience, how can you remove as much of that friction from the patient as possible? I.e., wait, I could have this disease condition, but in that moment, why not make it possible to enable that patient to find the doctor that they need to go to. Because they're going to have, it's not just calling a doctor, it's, wait a second, I may have MS. What doctor should I go see? Oh, a neurologist or a primary care doctor. Wait, I don't have one. Will that doctor take my insurance?
Right.
I don't know. How do I find that right doctor? How do I call them, get their availability? How do I make sure I'm going to the right specialist? Right? Every single one of these decisions is friction. So it's not just the content that's understood from that ad, but it's also all of the additional steps involved from awareness to action on behalf of that patient.
Yep.
And again, just like with health literacy, how can you remove as much of that burden as possible from the patient? How can you remove all those obstacles from the patient as well? So it's not just about health literacy is a piece, and it's a really important piece. But then even when you solve health literacy, you still have all these other administrative and bureaucratic and friction-filled challenges that patients have to go through.
Yeah, and now you're touching on access to care, right? And depending on where you live and what community you're a part of, that could be highly restricted. I mean, we were talking earlier, I live 70 miles outside of town. The closest hospital is a critical access hospital to me. May or may not be covered or in network, right? And all of these elements add confusion to the patient. And I've been in healthcare 12 years, and I'm still confused at times, right? So the average patient, confusion leads to non-action.
Yep, exactly.
And non-action leads to more acute, higher level care episodes that then are financially toxic and physically toxic, which puts more stress on the overall system. And so you can see how this domino or this snowball starts to build pretty quick. And it all could be, not all could be solved, but a lot of it could be resolved or lessened with literacy and access.
Absolutely. Absolutely.
You talked about value-based care and that model that's becoming more and more popular. And I want to get into that a little bit because I think with value-based models becoming more popular, health literacy is going to make a huge impact on the actual business side of healthcare. So talk a little bit about how health literacy and the value-based model are going to help each other. They could be synergetic.
Yeah. So let's start off just quickly with the differentiating, the difference in terminology of healthcare and medical care, right? Healthcare is, I mean, it's working out, it's nutrition, it's prevention, it could even be things like infrastructure, i.e., do you live in a neighborhood that has access to organic, nutrition-filled foods? Healthcare is, even goes even more upstream to that. How our agricultural system works, i.e., the fact that we as a country subsidize commodity crops, i.e., we're subsidizing high fructose corn syrup. We're subsidizing all these things that are actually making us disease-ridden beings, right? Heart disease, obesity, other forms of cardiovascular disease. I mean, it's rampant, right? So healthcare, I'll stick health literacy, of course, within healthcare, but it also, I mean, you can also stick health literacy, of course, within medical care as well. Medical care is in that moment when you realize you need to go see, when you need to go see a doctor. So when you think of value-based care, social determinants of health are a really, really important contributing factor to value-based care, i.e. it comes down to things like access. It comes down to things like, do I have the right coverage? Am I able to actually see the doctor that I need to see that can actually properly care for my disease when I need to see him or her, right? But again, when we think of health literacy is really the tool that unlocks everything on behalf of the patient with their experience with the healthcare or the medical care system. And so obviously the more you're able to leverage new types of technologies, artificial intelligence, that can, again, determine, while this patient is interacting digitally with some sort of digital experience, we detect that this patient has the health literacy of a fourth grader, right? For example. So the content begins to morph and change and adapt. It's not a one-size-fits-all model, but becomes a many-size-fits-all model, an almost unlimited size-fits-all model, where each patient is able to go down their own personally crafted journey, where the content just makes sense for that individual, right?
Personalization is the key to consumerization.
Personalization is the key to consumerization. It really is. And by the way, that extends to doctors, that extends to healthcare providers as well, which we're not even touching upon here. But when we talk about things like value-based care, health literacy is a real important key to be able to support that transformational shift from fee-for-service to value-based care.
Yeah, the impact that it has on the provider, we were talking about it earlier, is monumental, because now they can scale their approach, and when they, but scale it with personalization, which is important when communicating to that patient community. Tell us your story. I mean, how did this become a passion of yours? Give us a little bit of background on Chase and how that led to Ostro.
Absolutely. So I started my career in venture capital. I worked, I was interning at a fund called First Round Capital. First Round was the very first investors in companies like Uber, Warby Parker, Square, so tons of top tier consumer technology companies.
Great brands.
And great brands. And a lot of what these companies were focusing on, like the reason why you look at what Square has done for fintech, you look at what companies like Ramp and Brex have done for fintech. Like these companies have taken consumerization methodologies and applied it to legacy industries. I had a front row seat to it, right? So the company that I then started, I was fortunate to start with two former Googlers who had a lot more experience than me. I met them through First Round Capital, and we ended up starting a company called Parsible. Parsible brought consumerization to the deskless worker in legacy industries. Okay. So if you were to walk into an oil service manufacturing facility that assembles downhole tools, or a chemical manufacturing facility that manufactures different chemicals, or you were to walk into a CPG beverage manufacturing facility, every single one of these deskless workers used to use paper-based processes and procedures to do all of their work. Parsible created the software to automate and digitize all of that on a simple, seamless experience on a mobile device. And again, every single one of these deskless workers, one of the things that we recognized when we were going through customer development, i.e. how did we identify the pain points and problems of this industry, is that we recognized that every single one of these workers, anytime they weren't messing around with their paper binders, they were pulling out their mobile phones. And they were texting loved ones, they were sending emails, they were using the same applications that we're all used to using. So we said, well, why can't we just take everything that they're doing in their day-to-day lives and manufacturing beverages, manufacturing aircrafts, or doing critical oil service-based operations, regardless of the industry. Let's just take all of that, automate and digitize it, enable the execution of it, and then we have data to demonstrate where non-conformances are occurring. Like, to being able to prevent things like the BP oil spill. To be able to prevent error in manufacturing. How do we catch it earlier? And so that was the premise behind Parsible. We took a very similar approach. We were obsessive over providing a user experience that felt like a lot of these other consumer-based applications. So consumerization of legacy industries has always been a theme for me. I then met my co-founder Ahmed El Sayed, and I, to this day, I was not going to go down the path of building another business. I was actually going down the direction of venture capital. I was going to be either joining in or starting a venture capital fund. And Ahmed, asked me a question I'll never forget. July of 2018. He called me and he said, it's crazy. Look at what Hims and Hers is doing right now with lifestyle conditions. Why can't we just take the same types of technologies and platforms to address that need for very serious conditions?
Highly clinical,
intensive conditions, i.e. cardiovascular disease, pulmonology, dermatology, psychiatry, neurology, rare disease, like you name it, right? Any disease state, any set of indication. And that's when we recognized, okay, there's a massive pain point problem. It's the number, let's go and actually solve a really, really important, durable pain point and issue. And that led to the birth of Ostro. And I mean, really what we recognized day one was, for us, everything needed to be about regulatory compliance. When you're talking about the life science industry, whether it's pharma, whether it's med device, whether it's diagnostic technologies, everything comes down to regulatory compliance. So one of the things that we did was we reached out directly to all those regulators. And most companies take the approach of break it and then we'll play catch up. We didn't take that approach. You do not want to take that approach in healthcare more broadly, and a lot of companies are making that mistake. We were very serious about building that into our DNA as the core to our DNA. So regulatory compliance to us was everything. We reached out to those regulators and we said, we want to work with you on building regulatorily compliant, easy to use technologies that are going to make it easier for doctors to learn about new drugs, i.e. how do we shorten the time frame? Because again, if a doctor is not aware of a new drug on the market, they're not going to be able to effectively treat their patient, right?
They didn't learn about some of these new things 20 years ago in medical school. I mean, they have to, you talk about literacy and awareness on the patient side, it's just as important, maybe even more important for the provider community, like you're talking
about. Absolutely, and that's the key, right? Imagine if you knock on wood, you ever get a serious condition. David, it's never going to happen to David. I mean, look at him. He's obviously incredibly fit. He drives 70 miles to come work out every morning at 5 a.m. All right, that's all I have to say.
I paid you to say that. So.
Yes, paid advertisement. No, it wasn't actually. But no, if if God forbid something happens and you were to get diagnosed with choose the condition of choice. When you go see that doctor, let me ask you, David, are you going to want to would you go to a doctor that only knows a third of the potential treatment options?
Right. You don't want that.
Would you want a doctor? Imagine you had one that knew 100% of all potential treatment options versus the doctor that was very personable, that you really got along with, but only knew 50% of the options. Who would you go with? The doctor that wasn't friendly but knew about every potential treatment option, or the one that's very friendly?
Give me the jerk every time.
Exactly. Yeah. That's the idea. You want someone that actually understands all potential therapeutic options that can help cure you as that person's patient. And so ultimately, at the end of the day, so much of health literacy actually impacts doctors as well, right? If you're a primary care physician versus an oncologist and you're learning about a new cancer treatment, like a new CAR T therapy or a CAR NK therapy, then, well, first of all, the way that the primary care doctor learns about that new therapeutic and the way that a oncologist that's been specializing in leukemia lymphoma for 25 years learns about that new therapeutic are entirely different.
Sure.
So the health literacy of those two doctors, of those two HCPs, is different. So you have to be able to leverage technology to also personalize it at the level of the provider as well. And you want to make it frictionless. Again, the thing that every single company gets wrong that comes up with a new health technology, whether it's a digital health solution, whether it's, I don't care, I don't name it, electronic health record, a new point of care solution, I don't care, any new technology for a doctor, they get it wrong when they say, I'm building this technology and only a doctor can use it. No, if that technology can only be used by a doctor, then it's being built wrong. The user experience, I will tell you right now, sucks. I should be able to take that technology and put it in the hands of any consumer, regardless of their health literacy. And it should be able to automatically adapt and be usable and be frictionless for me. Doctors, they're using the same consumer tech applications that patients are outside the hospital. Right. In fact, even in the hospital, they're using Seamless, DoorDash, Postmates to order their food in the emergency department right now.
Right.
They're using Netflix when they remove their scrubs and they're at home. So why should the experience be different? Health literacy applies to everyone, not just patients, but also doctors. And like you said, it's potentially even more important for doctors to know about it, to be able to actually educate their patients on some of the pain points and problems they're seeing in their care.
Yeah, you're putting a lot of stress on the provider to understand, consume, and then prescribe. And so that friction there has to be eased in some way. This idea, the ability to improve the health literacy or to match that individual's health literacy with the information breaks down a lot of barriers.
Yeah.
I mean, we've talked about all kinds of stuff, from value-based care to literacy to equity. If we were to leave our listeners with one thing, if you could walk away with them understanding one thing about our conversation today, what would that one thing be?
Stop making healthcare so hard, right? It should be easier than every other experience in your life. And the fact that it's not means that you should all, as patients and doctors, be fighting every single day to ensure it gets to the point that it's easier to use than Netflix, easier to use than ordering food, easier to use than Amazon. It should be easier, because without your health, David, you've got nothing.
Health is everything. It's the most important. So it should be easier and more consumable.
Absolutely.
Well said.
Yeah.
I appreciate you sharing.
Absolutely. Thanks for having me, David.
Good to see you.
Yes, appreciate it. Thank you.
Thanks.